Hello and welcome back to Rural Health for You and Everybody. I'm Amber Sorensen, the Marketing Director at the Murray County Medical Center, and I'm here with Jenni and Denise, and we're going to talk about EMS services at MCMC and in Murray County. Hello guys, how are you?
Good.
Good. Why don't you each introduce yourselves to our listeners and some of what you do here in your roles?
I'm Jenni. I've been here for 13 years. I'm the ambulance director. So I take care of the ambulance service. We do everything from billing to scheduling to payroll. So that, and coupled with maintenance of the rigs, supplies, and keeping the trucks oiled and running so we can respond 24/7.
And I'm Denise, and I've been with the service for 10 years. I am the EMS assistant director, and I help with doing state forms and filling out things for billing and helping with Jenni with those things and trying to keep things running smooth.
So Jenni's right-hand woman, basically.
Absolutely. Couldn't run without her.
So, as you guys know, National EMS Week takes place annually in May, and that's kind of going to be what we're focusing on. Can you talk about the importance of this observance and how you try to take the time to recognize the important contributions and efforts that your crew makes in our community?
Absolutely. I like it that it's nationally, so it's not just locally. So EMS kind of gets a chance to flaunt their stuff, be able to remind everybody that we're here, even though a lot of people forget that we're here until they need to pick up the phone and dial 911. So I like the fact that we can have a national week where we take the time out to acknowledge and recognize and then just remind the community what we're doing. It's not all, blood, guts, and gore. We do a lot of community service. We do a lot of assistance through medical transfers. We take care of the community and their medical needs. So I like that aspect of it. As far as like our crew contributions, it's just a fantastic opportunity to really highlight those individuals, especially here in Southwest Minnesota. We are rural EMS. We rely heavily on volunteers. Our specific service, besides Denise and myself, who are paid staff, we have volunteer staff. The rest of our staff is volunteer. So that makes it important to remind everybody that without those volunteers, we wouldn't have an EMS service to support this community. So really just reminding them of that setup and who is there to answer the call, and that if we don't continue to get volunteers, we won't have anybody to answer the call. So it's a vital part of our service.
For sure. Anything to add, Denise?
No, volunteers, I don't think people realize that we're volunteer. I think they just, sometimes I wonder what people think, that we are sitting at the garage, like big city, but that's not us. We all have a life, and, it's just part of who we are.
For sure. And Jenni, you talked a little bit about it, but just to get a bit more in depth, what ambulance services are offered here in Murray County, and I guess how does MCMC kind of play a role or a factor in those services that are offered?
Good question. I'd like to first point out the fact that we are a department of the hospital. Even though the side of the rig says Murray County Ambulance, it all ties back to the hospital is owned by Murray County. But we are ran and operated, our budget, everything is fully functioning out of the hospital. So we are a full-fledged department of the Murray County Medical Center, which has been amazing. All 13 years I have been here, we have been a part of that hospital team. We get direct access to supplies. We have an amazing team of business office administration to help with all of the needs that any business requires to function. So we are just pleased to be a part of that team, to have had that support for as long as we have had. And it just creates an even more foundational structure of a service so that we can just keep going, right? We don't have those needs. We don't have to worry about, are we able to pay the bills or not? This is not a money-making venue, unfortunately. So what other things do we offer? Well, first and foremost, we are a BLS service. That is a basic life service. We offer the basic needs to keep someone alive, is essentially what that is. And then the alternative to that is an ALS, Advanced Life Services. So ALS is going to have medications. They're going to need RNs or paramedics who are trained in pharmacology and can give those higher, more needed medications that we're not trained on. So a lot of schooling needs to go into that for that level. So our 911 calls are all based on BLS capabilities. We do have a couple variances in there where we can offer IV services with just normal saline. Some of our crew members are very skilled at that and can get that going while we're still in the field. We have other medications that we do carry that is per our medical director. So all of that is available 24/7. We have 2 ambulances. One is fully staffed at all times. The other one is used for transfers and for incidents that require multiple services to respond. So we do a lot of transfers, as I just said, for the hospital. The hospital provides nursing staff to give us that higher level of care. So we do a lot of ALS services in conjunction with our nursing staff. So that means the nurse will ride along in the back of the rig and take those critical care patients to anywhere. We have gone to Rochester, Mankato, Sioux Falls, both Avera, Sanford, the Heart Hospital, you name it, we've probably been there. Furthest we've gone is probably Thief River Falls.
Yeah.
Yep, I think that's furthest. Fargo. We go all over wherever that specialty care is needed. So a lot of transferring back and forth. We even do non-emergent transfers where an individual is getting released from their stay here at MCMC and they don't have capabilities of using public transit or personal vehicles. So we have done non-emergent transfers back to homes or nursing homes or different levels of care that way as well.
So you talked a bit about transfers. So just hypothetically, for the listeners to get a better understanding, say I had some incident, which may or may not come up, who knows, but say I had some incident that the ambulance services here didn't necessarily have the capabilities to attend to, something really serious, who knows what, I'm not medically trained. How would that work if, say, I called 911 and it was something serious, you guys didn't necessarily have the capabilities? Would that be like a transfer from the Murray County ambulance to like another facility, or how would that work?
Anything 911 we take care of.
Okay.
So it doesn't matter on the severity. We are trained to take care of an individual's life and limb. Transfers only come when you're trying to move a patient from one facility, like a hospital, to another facility, either of equal value or higher in care. So that's where transfers come. We've seen everything on 911 calls. We respond to everything, small as someone got a paper cut to as big as doing CPR on scene. So
Sure.
some of the other services that our Murray County Ambulance offers is just, I wanted to touch a little bit on the fact that our volunteer service is well equipped. Like I said, we got 2 ambulances. We have an ambulance garage that's got a full kitchen, washer, dryer, 2 bedrooms, a great staffing meeting room. We've got a computer for reports and couch and TV. for those that maybe live a little bit outside of that response time zone and they want to stay at the garage. It comes real handy when the winter storms get pretty bad and can't be driving during the blizzards. So
Spent a lot of time there.
yeah, we do offer that for our staff comfort, and it's conveniently located right next to the wellness center. So offers right next door down the hallway, all the workout equipment and showers, and it's just kind of a nice setup for those volunteers who do want to put in time.
For sure. And that kind of gets a bit into our next topic. How would either of you or both of you say that our ambulance services and personnel kind of differ from crews that people might otherwise encounter, say out of bigger cities, middle-sized cities, wherever you're thinking of?
What comes to my mind is here, it's more personal care. You get into the larger cities and you're more of what's wrong with you. You're more of an illness or an injury than you are an actual person. And I think and we know a lot of people that we would pick up as opposed to the cities. Everybody's a stranger, and I like that aspect of it. You get to actually, a lot of times you know who they are. Sometimes that's good and bad, but in the situation, but I like the rural area mentality.
I think that is a huge part of it. People want to naturally help, so they want to be able to help their neighbors and their community members. I'd say one of the biggest things that our volunteers is brave. They are brave enough to take on the challenge, to respond at someone's darkest hour, and be there not only for that patient, that individual who may be hurting or dying, but also for the family members in the community. Denise and I have been doing this for a very long time. You cannot drive anywhere without seeing somebody that you have met on the job. Touch their lives in some way, shape, or form, both good and bad. So being brave is huge. I think all of our volunteers are brave enough to do that. They walk towards the chaos. They don't run away. They want to help. They want to be there in the thick of it. Besides that, the uniqueness of the job is something to consider as well. We definitely see everything. Like we mentioned before, you have very simple calls in the manner of someone is very sick and they're weak, they can't get transported. We can help them move, their mobility is limited, all the way up to a severed limb or exposed bones. Not everything is blood, guts, and gore.
Yeah, when the pager goes off, you can't just say, oh, at 2 o'clock today, we're going to get a call for a sore throat.
Right.
We don't have a schedule. I said, like the clinic, you can say, well, at 2 o'clock, we're seeing this. At 2:30, oh, this is coming in. Yeah, we don't know what's coming in, what we're going out to. It's completely
unique.
Yeah.
Having that situational awareness to the job in of itself. Like Denise said, nothing's scheduled. There's no structure.
Very unpredictable.
Very unpredictable. So that is very unique about this job. Our volunteers have to be able to handle, at the drop of a dime, going from mom to CPR, saving someone's life, and that takes a big toll on someone's physical and mental abilities. So
being in the middle of a family dinner to get called to something that
Yep. You stay on the job long enough, you get called away from everything.
Oh, yeah.
So that definitely gives our volunteers an edge and should be commended on how they can just jump from home life to work life to EMS life. Definitely isn't something that is for everybody. That uniqueness makes us stick out in our dedication, our ability to jump from hat to hat in our lives.
For sure. And if someone that's listening is getting or has already received their proper certifications, whatever that may entail, and would like to join your team at some point in the future, how might that process look like, just since it is kind of more volunteer based, whereas with other organizations it may be a different process?
Yeah, absolutely. Right now we run a schedule where we staff 3 people. 2 is required per state law. We try to run with 3, so we staff 3 different positions. We have a driver position where you would need a driver's license, a CPR certification, and a clean record to be able to drive the ambulance. Then we offer a second position, which is a licensed requirement. We have 2 licensed requirements. This one is a emergency medical responder. So the difference between that and an emergency medical technician is the amount of hours put into the educational program to obtain that license. Just kind of like an LPN and an RN, there are different hours and requirements. So same thing, EMR and EMTs have different requirements. So we do hire EMRs and we do hire EMTs, and those are the 3 positions that we currently hire for. If you are on our MCMC team, we have utilized our RNs as well to take those ALS and BLS transfers that are needed through our facility. So we do utilize RNs as well for that position. We would definitely hire an RN to assist with transfers in that manner as well. So 3 different positions on our service. How does that look like if maybe you're interested, but you don't have a license? Well, you can start out as a driver, and we have grant funding available to pay for education so that your education is 100% free as far as your administrative costs, your class cost, your book cost. However, you do have to dedicate your time, and you do have to give back to the service. So we'll pay for that education if you're willing to commit 2 years to the service. 2 years are going to be equivalent to your 2-year license that you would obtain when you completed schooling.
Sure.
So for someone that maybe wants to just see if this will work for them, they can definitely join the team through our normal hiring procedures, fill out an application, talk to me or Denise or anybody on the ambulance service to get an idea. We can throw out job descriptions for people who want more info on it. The call hours are paid. You do get paid to take call time, and that is per a schedule. So we do 12-hour shifts. We break it up however needed. We've got some people that take 8 hours a day, some people that take 5 hours in the day shift. Just depends. Or like I said, besides Denise and I, everybody else is a volunteer, and that just means that they volunteer the time that they're available to take call. And we make it work. We cover the schedule that way. All of our 18 volunteers have full-time jobs outside of their role here on the ambulance department, and we do everything we can to work around their schedules and to make it work. We do require that individuals come to a monthly training so that they can maintain their training. We want to see them stay up to date on their skill set so that they have that continuous refresher of EMS. If you don't use it, you lose it, right? So we are very honed in on the fact that we have to keep up to date on our skill set.
For sure. And we will link the careers page with job descriptions in the description of this episode. So we'll throw that in there.
We do a lot of, EMS is not for everyone. Some people join, they do it for a little while and decide that it's not for them, and that's okay. Yeah. We see a lot of high schoolers going off to college. They really want to hone in on the medical field. This is a great stepping stone to get experience, to gain patient contact hours, to have a great fantastic resume. I mean, I will write letters of recommendation if they're willing to dedicate time to our community and to this service. So it's a great resume booster for those that really want to seek out medical fields. So highly encourage those guys to call and look into it. Yeah, we've been known to just be a big old stepping stone. We've seen a lot of kids grow and succeed and flourish in their medical careers, and very proud to be a part of that journey for them.
For sure, definitely. And before we wrap up, anything else to add from either of you?
We're not the only ones in rural EMS. We got our neighbors Fulda, who also thrives off of volunteer services. Volunteers, they need volunteers just like we do. There are a lot of services that can't maintain schedules in our region because there's no one to get behind the truck. So just in Murray County, we're blessed to have Fulda Ambulance, and we're blessed to have our service up and running. And right now we're staffed so we can maintain the schedule, but there are times when we can't, and it gets pretty scary. So if you're on the edge and you don't know, seek out anybody. We can point you in the right direction. Maybe you live in Fulda and you want Fulda's contact info. All the towns around here, our EMS is struggling with staffing. It's a statewide, I'm sure national-wide crisis. So if you have any desire, look up your local services, our local first responders. We service towns around us, Lake Wilson, Chandler. We go into Iona and Avoca. We go up to the lakes and cover Curry, Hadley. All these towns have individuals who, are first responders and can respond quicker than we can. And those units are vital because those minutes are essentially life that you could be saving. So if you're not in Slayton or you're not in Fulda and you still want to help, there are ways to help outside of just joining the service.
Absolutely.
Well, a lot of first responder units can use help. You can respond from home. There are a lot of flexibility. I mean, we live in rural EMS. We have to acknowledge the fact that we are miles from town and accidents happen everywhere at every hour of the day.
For sure.
Very much.
Well, thank you guys for joining us. Appreciate it.
We appreciate you.
Oh, thank you.